Welcome to the first new episode of Emerging Europe Talks Health. My name is Andrew Robel. I am the founding partner of Emerging Europe, and I am joined today by Balazs Furjes, Managing Director at EIT Health InnoStars. EIT stands for the European Institute of Innovation and Technology, while InnoStars covers European countries with modest, moderate innovation capacity, but which have great potential. Balazs, welcome to Emerging Europe Talks.
Welcome. I'm happy to be here. Thank you very much for the invitation.
The coronavirus has been with us in Europe since the end of January, and it is clear that it has changed our lives in an unprecedented way. But today I'd like to talk about its impact on healthcare and health tech. So 5 years ago, Bill Gates said if anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. We've actually invested very little in a system to stop an epidemic, and we're not ready for the next one. This was 5 years ago, so how unprepared were we for the coronavirus?
It's very hard to be prepared because there are different diseases that will attack different organs, so you cannot stock equipment in advance. The most important thing is flexibility and an agile system. And if you look at the different stakeholders, different segments, the politicians, the government, the healthcare, the innovators were the fastest because it is in their blood. They reacted immediately, and here EIT Health, that is linking these innovators cross-border throughout the whole Europe, reacted fast as well. So this agile system and innovative ideas that will really react on anything that is thrown onto us is the most important in such a case, and we were well prepared.
So let's keep on looking at the situation in a broader context. What have been the most surprising or unexpected outcomes as far as fighting the coronavirus is concerned?
There are a lot of cooperations that wouldn't have happened if there is not such a great pressure. So, for example, in Portugal, our partners developed a global tool for planning the beds, the equipment, the personnel, and how to respond to the coronavirus disease. That was linked with the Portuguese Association of Hospital Administrators, and this tool is currently used by the WHO. It is on their website, and country by country, a lot of other regions are adopting this mechanism. There's another example. There was a European-wide hackathon against the virus, and Team Discover, a team from Hungary, they developed a 3D printed prototype of medical device. The nurses don't need to go into the room with the patients, with the infectious patients, because this device is measuring all symptoms of the patients. And it's low cost. It has been invented right now on the spot during a hackathon against the virus, and they became the winner of the health-related category of the EU versus virus out of 900 teams. And this team was mentored and also subsidized, funded by EIT Health as well.
Can you share any best practice that you have seen?
The best practice is if you already have a trusted network. And we are building EIT Health for 10 years. So these people in various areas and countries connecting the best innovation hotspots of Europe, they could easily pick up the phone, call each other. They could combine existing technologies, new ideas. They knew which company to connect to in order to bring it to the market. So this is the absolutely fundamental that prevents the next damage if you have such a virus, that you have and maintain this network of talents and innovators.
Scientists around the world are still working on the vaccine. That is still a valid challenge. What were and are the biggest challenges in containing the virus and the pandemic?
The first one is this accessible telehealth, the widespread digitalization of the healthcare, integrated into the pathways of the healthcare system and reimbursed. So it's not a nice to have, it should be the core technology of the healthcare system. The next one is this agile networks and fast collaborations. That's what I already mentioned about. So without it, EIT Health wouldn't have had 50 new innovation projects to fight the COVID-19 within a month. And the third one is need-based innovation instead of technology push. So in peacetime, there are a lot of ideas where the technology is looking for a market, but they rarely succeed. Now we have a clear need and a much higher percentage of innovations are really successful. And I hope it will stay because it's a fundamental change in the minds of the people. The last one is just privacy and data protection needs to be resolved because the current situation has a lot of question marks all around in Europe, but also in the world.
In the second part of this episode, Balazs and I are going to look at how COVID-19 will impact healthcare and health tech going forward. Stay with us. Even the worst-hit emerging European countries have infection and death rates per million inhabitants much lower than Western European nations and are slowly coming back to normal. In mid-May, Slovenia became the first country in the EU and emerging Europe to declare the end of the coronavirus epidemic. The Baltic countries of Estonia, Latvia, and Lithuania have opened their borders to one another, creating a coronavirus travel bubble. Montenegro has not registered any new cases since May 5th. Emerging Europe covers the coronavirus pandemic in the region, but also other social, business, economic, and political topics related to the region. For more news and analysis, visit emerging-europe.com. This is Emerging Europe Talks Health, and we're back once again with Balazs Furjes, Managing Director at EIT Health InnoStars, to talk about how he sees COVID impacting healthcare and health tech. So we have already seen that some countries are very slowly coming back to normal, but it seems that normal will never be the same. What lessons will healthcare systems learn from the pandemic, and what changes will have to take place?
One of the major change is the flexibility. The flexibility in the minds of the patients. They need new ways of getting treatment. They cannot always access the doctors, the hospitals. So telehealth will be a major winner of this pandemic. But this change of the minds is needed at the doctors, at the hospital management, but also at the regulations and the governments as well. So the whole healthcare system will change, but the first change needs to be in the minds. This is the same, just like if it is just a temporary change and everything goes back to normal, then nothing will change.
You have already mentioned that, but let me go back to it. So emergency rooms have seen the number of people they have to deal with fall considerably as people realize that they do not need to rush to hospital for every cut finger or toe or minor injury. So people appear to have become aware that emergency rooms are for serious, immediate problems only. Is this likely to be a continuing trend?
Only if the whole system changes and supports these changes in the current behavior of the patients. Because the patients will always react to the offers the healthcare system is offering to them. So if the regulators and the hospital management is looking at it and they welcome this change, but it is a welcome because the emergency rooms are the most expensive way of contacting patients, then I hope that it will change. It is the same like the internet. Until there is no pressure, people are less ready to switch to online conferencing, for example, or education is very hard to change unless there is such a pressure. But as the home office in the workplace or the digital education in the schools, I hope that these changes will remain in the healthcare system because we need it. Otherwise, the whole healthcare system with the aging population is not sustainable.
Do you see more startups with innovative ideas entering the market? If yes, which areas will they innovate?
I see a lot more startups coming in the new age because if the healthcare system is digitalized, then it becomes a totally different business model. Then it becomes a computer where you can develop a lot of applications. New entrants into this system can develop these apps, and we will converge different industries, which is just increasing the number of opportunities and the talent who can tackle the problems.
Where do you see even more technology coming in? Artificial intelligence, automation, big data, Internet of Things? Where?
All of them. Let me address two or three of them. So IoT, Internet of Things, is very important. So currently we have a set of capacity, the hospitals in the healthcare system. With the aging population, we have an exponential growth in cases. Elder society, increasing problems with the health. Most of them are age-related, which has a longer lifespan, also not a healthier one. So, but we don't need hospital treatment. So there's telehealth, home care will rise, where sensors put on the body in the homes of the people will monitor the people, because they don't need to spend their time with obesity, with diabetes in the hospital. AI and big data is very important. In the past, doctors reacted. So once you have we had the symptoms, then you get treatment. Again, it is very expensive. With AI, we can predict who is going to be ill, and therefore we can catch the disease much earlier, and we can really prevent it. So prevention is much more cost efficient than treatment, and AI and big data will help a lot.
What we have learned over the last few months is that partnerships and collaboration matter a lot in such challenging circumstances. How will that evolve, and what results or changes do you expect?
I think innovation that is currently done is very time consuming, because all the conferences, the meetups, the pitches, the investor relations, in the past, they were required face-to-face, because I have to look into your eye, I have to shake your hands in order to make a deal or to work together. And it is not sustainable. It hasn't been sustainable before the pandemic. So I hope that with the current move, that all these connections, introductions, trust building, and cooperation is moving into the virtual space. It will remain in this space, and it will accelerate in growth, because then you don't need to team up and work with the talents from your close proximity, from your city, but you can really optimize these networks across Europe. You can link the best hubs, the best institutions, the best talents. If you are a talent in a less developed country, you have the opportunity to approach the best clinics or the largest corporate headquarters in Europe or everywhere in the world. So you don't have the limitation of your geography. And it is a tremendous potential for us, especially for InnoStars, because we see that during the pandemic, 30% of all the innovations, all the ideas came from our region, which is a higher representation that our share would have required.
Balázs, thank you very much. This was Emerging Europe Talks Health. I spoke to Balazs Furjes, Managing Director at EIT Health InnoStars. Balázs, thanks for your insights, and everyone, thanks for listening. Stay tuned to the next episode of Emerging Europe Talks, and stay safe.